Today I would like to talk about a young girl who had come to me with some hematological problem and she had a massive splenomegaly.
Amar ছোৱালীজনীক লৈ পেলাই মই স্প্লিনৰ অপাৰেশ্যন কৰিবৰ কাৰণে আহিছিলো তাই জন্মৰ মানে 3 মাহৰ পৰা মানে এটো প্ৰবলেম দেখা দি আছিল আৰু তাৰ বেমাৰটো হৈছে মানে থ্যালাসেমিয়া.
Thalassemia is a genetic problem where we see the disease is coming from both parents, mother and father, and ultimately the child ended up with major or intermediate thalassemia who need regular blood transfusion. And sometimes the patient has a huge spleen. The spleen size increases in the abdomen, and because of that patient has some problems and the transfusion of blood requirement is also increases.
এই thalassemia বেমাৰটোৰ কাৰণে মানে তাই মানে বহুত ভুক্তভোগী হৈ আছিল আৰু মই বহুত ডাক্তৰৰ লগত কনসাল্ট কৰি পেলাই আৰু হেহতিয়াকে ক'বলৈ গ'লে মই অভিজিত ফুকন ছাৰৰ লগত হেমাটোলজি অভিজিত ফুকন ছাৰৰ লগত ডিসকাস কৰিলো আৰু এই ডিসকাস কৰি পেলাই সাৰে সাৰ্জাৰী ডাক্তৰ এপোলো এক্সেলকেয়াৰ ডাক্তৰ কৌশিক বৰুৱা ছাৰৰ লগত কনসাল্ট কৰিবলৈ ক'লে.
Spleen is basically an organ in the upper part of the abdomen which filters the blood, and because of the hematological condition there was increase in size of the spleen and it was very friable. So when she came to me, she was a small girl, so I had planned to do a laparoscopic surgery. Laparoscopic splenectomy is a difficult surgery because inside the abdomen we get very less amount of space as the spleen is occupying most of the space inside the abdomen. So there is hardly much space to move and the operation becomes critical at times. Also, as the spleen is grossly engorged, there is increased chance of bleeding if there is an injury to the spleen. So the surgery becomes even more difficult and the chances of blood transfusion is there.
So this case was actually very interesting case and very young girl, so we decided to go with splenectomy, and we are continuing with the regular medications are not helping, so I referred the case to surgery department under Dr. Kaushik Barua.
Taking out the spleen after the completion of the operation becomes difficult because it's a huge organ, and in the laparoscopy, as you all know, that we make small holes inside the abdomen, and we take out the specimen through the small holes. But taking out this huge organ is also much of a problem, and there also we struggle a lot.
Under his guidance with a laparoscopic surgery, the spleen is removed, and after the splenectomy we have seen tremendous results, and the girl is actually now transfusion free. She do not need any blood transfusion and her symptoms are also significantly reduced.
ছাৰ সকলক বহুত ধন্যবাদ আৰু Excelcare হস্পিটালৰ কৰ্তৃপক্ষকো মই বহুত ধন্যবাদ জনাইছো.
I would like to tell that this girl, she underwent laparoscopic splenectomy successfully and she is doing well now.
Thank you Dr. Kaushik sir and thank you Dr. Abhijit sir.